Hi, I'm Jess Jenkins. I'm a women's and pelvic health physio, and I'm also known on social media as the Mama Physio. Perineal massage is a massage technique to the area between your vagina and your back passage, and it helps to improve the elasticity and reduce tearing during childbirth. Research shows that perineal massage in first-time mums, when completed from 34 weeks of pregnancy, can help reduce your incidence of tearing and episiotomy by 21%. It also helps reduce your risk of high-grade tears, so like a 3rd and 4th degree tear, by 64%. You'll also get less pain in the perineal area after birth, regardless of tearing, and also improved wound healing and elasticity. I'd recommend doing perineal massage from 34 weeks of pregnancy, and I'd be doing it twice a week unless you've been advised otherwise. There's two main techniques that I teach my patients when performing perineal massage. The first technique is reclined or recumbent, and you might get your partner to help with this as well. So generally I'd recommend lying back down on your bed and propping yourself up with some pillows so you're not completely flat on your back. You might have a shower first, and then you will grab your perineal massage oil and you'll put a little bit on the end of your finger, and I would massage outside and just apply it to the perineal area to start with. And then make sure that you have got some on your thumbs as well. So lying back down, you will reach both thumbs around. And if you think of this area like a clock face, so 12 o'clock is up towards your urethra, 6 o'clock is towards the bottom, towards your back passage. We're going to be stretching towards 5 and 7 o'clock to the sides there. So you'll grab your thumbs, they'll have perineal massage oil on it, and you'll insert them 3 centimeters and you'll stretch down and out in that 5 and 7 o'clock direction. You'll hold in the stretching position, and it might feel quite uncomfortable. You might feel a bit of like a burning sensation. And I would hold for up to 60 seconds, focusing on relaxing the area, big deep belly breaths as well. If you can't reach around yourself, what you can do is get your partner involved here. So they might use both of their thumbs or they might use both of their pointer fingers, but they'll be doing the exact same stretching in the same direction as well. Once you've done the 60-second stretch, you will repeat that again, and then I would finish with some sweeping at the back from 5 till 7 o'clock as well. You might need to reapply a little bit more perineal massage oil as well. Technique number 2 is in a standing position, and I find this is the position that's easiest for my patients to complete their massage on their own. You will need to put your foot up on something, so you can put it up on the toilet or the edge of the bath, or if you have a little stool as well. You'll grab your Pure Mama perineal massage oil and you will put some on your thumb or your pointer finger, and you'll firstly just apply it to that perineal area to start with, just to help promote that elasticity and moisturize the area before we do the massage. So you'll put your right leg up onto a stool and you'll reach the opposite thumb underneath that thigh and reach around to that 7 o'clock position. And you'll insert the thumb 3 centimeters into the vagina and you'll stretch down and out at that 7 o'clock position, focusing on breathing and relaxing the area, maintaining that stretch. Then you will swap arms and legs, so the right thumb, and then you're going to be stretching in the opposite direction as well at that 5 o'clock. Same thing, holding for 60 seconds. I'd repeat that again on both sides and then finish with sweeping at the back for 60 seconds from that 5 to 7 o'clock as well. The biggest misconception about preparing for labour is that your body is just built to birth and that you don't need to do any preparation at all. I feel like it's quite naive to be going in with this mindset. We have such a lot of evidence to show that educating yourself on labour and different outcomes and all the different things that can happen during labour is what helps reduce birth trauma. 3 signs your body's getting ready for birth. Number 1 is strong, frequent contractions. Number 2 is a bloody show or losing your mucus plug. And the third one is your waters breaking. After you've given birth, the area might be swollen or painful. And so I would firstly be accepting all of the pain relief that you were given. I'd definitely accept an ice pack. They'll normally give it to you wrapped in a little gauze or toilet paper, and you can pop it in your underwear. If you've got compression underwear or leggings, I would also pop these on. That will feel really nice just to give you some support from underneath, just to help prevent that swelling as well. And lastly, I'd recommend the Pure Mama post-birth spray. So this includes witch hazel, which is really nice to soothe and cool the area. You can spritz it onto the perineal area, and that will help cool it, especially if you've kept it in the fridge.